I call the member for Maitland and Shadow Minister.
Thank you, Mr Deputy Speaker. And I rise to speak on the Health Practitioners Regulation Amendment Bill 2017. And broadly speaking, this bill will update the regulation of health practitioners in this state, recognising paramedicine as a registered health profession, allowing consolidation of the National Health Profession Boards into a single national board, separating nursing and midwifery professions and recognising them as two distinct roles amongst other changes. Unfortunately, Mr Deputy Speaker, what this bill cannot do is to resolve the crisis in the New South Wales health system. Delays in our health system are reaching dangerous levels. In the New South Wales system, the New South Wales health system in this state, patients wait at every stage. They wait for an ambulance, they wait with paramedics outside the hospital to get into the emergency department, they wait in the emergency department, then they wait for a bed, then they're rushed out of hospital before they're fully recovered. And that's for those who aren't even on elective surgery, who I'm told the newest thing now is that they check into a bed and then while they're down in surgery their bed is taken and they spend the night in recovery. I mean, this is just a disaster of a system all the way through. And I don't blame the current minister for this. These problems have come from the systemic lack of resources that have been stripped out of our health system from this state government. A shortage of hospital beds has meant that patients rush out. They get under the coalition government, we have some of the highest rates of post-surgical complications in the world. In my electorate of Maitland, we have nearly a third of patients waiting more than 4 hours to get into emergency. More than 4 hours for an emergency. That is just shameful. Now, ambulances, of course, come under this, and we've seen around the registration of paramedics as a health profession, but we need to ensure that those paramedics are properly resourced. And the Minister would be aware, because I've had many cases coming into my office of people who have called for the ambulance on a number of occasions. In fact, one woman actually died. The truck kept... Is your appointed, or are you just standing there to hear clearer? What would you like, Minister?
I'd like to take a point of order, but thank you for
order.
Thank you.
Does the Minister have a point? Rise on a point of order, do you?
Deputy Speaker. Whilst I'm, of course, very open to the honourable members' correspondence and discussions with me about particular health issues, and there has been some of those already, I'll just point out that this is strictly about an administrative bill, and I'd ask the honourable member to bring herself back to the lead of the bill.
Mr Speaker, before you rule on that, can I...
Is that further to the point of order?
Yes, it is further to the point of order, and that yourself and other speakers have allowed a wide latitude of discussion in second reading debates around legislation. And obviously, when we're talking about something as complicated as a health system, to talk about it as just an administrative change, sometimes you need to actually look at other components within the system and how they're all working together. And this is very important because it makes an enormous difference to those people who are professionals in our health system. And it's not enough, as I said previously, when the former health minister was... Well, no, but further to this point of order, when the former minister was making changes to recognition of professions. I mean, you can call people Ronald McDonald, but if you don't provide them with the professional support that they need, like that, you know, they can't do the work that they're supposed to be doing.
Order. I'm going to call you to come back to the bill because it is about where they're recognising the paramedics as a registered health profession, and you know, you're not speaking against the bill, are you?
No.
No, that's right. So I'll bring you back to the lead of the bill.
Thank you, Mr Temporary Speaker, and I thank the Minister for his input into that. It has been noted. I'm just talking about the registration of health professionals, and we're talking about paramedics. And the point I was going to make is the government has actually promised to build new ambulance stations in my electorate, but it doesn't matter what they do if they are not going to actually provide the resources to those staff to do the work. So, as I was saying, we've had people who've come to my office because the paramedics have not been at fault at all, but the fact is they have not been resourced to come with ambulance. They've come with trucks which have not been able to provide transport. And the very important thing about ambulances is not just that they are paramedics, but also that they are able to transport sick people. And if those people are then being told, well, just catch a cab or get in your son's car or do something else to get to hospital, that's a problem. And, I remember speaking to the Chief of Staff of the former Health Minister again on this point about paramedics and ambulance stations and the promise that we would get a new one in Maitland Hospital. And I think there was 5 separate questions that before we could get the straight answer that the promised ambulance station wasn't in the budget, and my understanding is it's still not there. So I'm also concerned about issues raised by the member for Port Stephens about the staff at John Hunter Hospital who've been taking industrial action to show the government about the issues they're facing as being understaffed, and that is really the hub of this issue. You can have the world-class health system, you can have all the great buildings that you would like, but if you don't staff those buildings, if you don't provide those professional people that this bill is talking about, then you don't have a system at all. And, earlier this year, staff at John Hunter were forced to strike because the government had failed to respond to incidents of workplace bullying. Obviously there's a lot of work that needs to be done when people are in such a stressful situation at work that they are having these issues. So the Maitland Hospital, of course, is one of my major concerns. As I said before, 32...
Mr. Speaker.
Call the member for Parramatta.
Thank you, Mr. Speaker. 76, I think it is. Asked the member to return to the lead of the bill. I think she's, in fact, flaunting your previous ruling to return.
I think I nearly have to agree with that. That some of the comments that were made certainly are not reflected in this bill. To the changes in this bill.
Mr. Speaker, the nub of this whole argument is that you can make any change to the professional recognition, the boards, you can comply with other states to go towards the national system. But if you do not fund the system, you do not do justice to the people who work within that system, you do not do justice to the patients within that system. And, Maitland is the fastest growing city in New South Wales outside of Sydney. This is a vital concern to my community to have these professional people in our health system. We've had a city that's grown by 15% from 2011 to 2016. We have not seen a commensurate 15% growth in services by this government in the health sector in that time. In fact, we've seen a much promised hospital which has not been built yet, and we are hoping that we will get something by the end of the year. But again, we need to ensure that our services are being operated to the best of our ability, and it is not just about recognition, it is not just about giving someone a name, it is about funding them properly. So I would like to leave it there, Mr. Speaker, and I would just urge the government to think about more than just fancy names and recognition schemes and actually fund our hospitals and build my new one. Please, Minister, soon, and make it public. Thank you.